Hello. I recognize this is an exceptionally challenging time as we deal with all this. It is for our society, it is for us here at the laboratory. I want to emphasize we do not have a confirmed case of COVID-19 on our site. We are trying to provide the best information available that we have, and behind me, the slide shows our site where we're collecting all the information and that we have, and we're updating that as we know more. I understand that everyone is dealing with a very stressful situation, not only at work, but also at home. And we encourage you to be sure to take care of your family, your neighbors, and your loved ones in this difficult time. We're trying to provide the best information we can to help you to do that. Today at our meeting, we have both Dr. Timur Durrani and Michael Brandt, who are talking to you after I talk. I'm the only one here that does not have a degree in public health or medicine, so I'm not going to be leading this discussion. So what I would like to do is turn it over to Dr. Durrani and have him take it over from here.
Thanks, Michael. Good morning. Thank you for tuning in. I'll keep my comments brief. As you probably know, we have two previous presentations which are online for you, which discuss some of the science as well as we knew them as of Monday and probably a month before. I do want to emphasize that although we don't have a case now, we can anticipate a case within the community and probably on the lab site, and we have plans for how to deal with that. And then the last piece is I would just want to reiterate what Mike said, is to try and take care of yourselves. It's a very stressful time. So if I had any advice beyond what we're dealing with the COVID is making sure that everybody gets some rest, that everybody hydrates, and wear your seatbelt. These are all things that we know are going to reduce risk for a variety of things going on. I'll turn it over to Michael.
Okay, good morning. What I'd like to do is go backward. We've been working on addressing the COVID crisis for more than 2 weeks now. We established a critical incident management group more than 2 weeks ago, and our focus has been to work with our lab experts to understand what we know and also what we can expect and what we don't know about the emergence of this virus and the impact on our workplace. So as an employer, we've been taking these specific actions you can see here. We've been engaging with all of you. You've been sending in questions to us, and our complete focus is to intervene early to reduce the severity of any impacts at our laboratory. And by doing that, we'll be able to help assure the health and safety and well-being of all of you. And so you can see that there are many things that we've been doing, and we've also been asking, there are things that you can do, as Dr. Durrani stated. There's simple things such as washing your hands, covering your coughs and sneezes, maintaining social distance. And the purpose of this morning's meeting is to hear from you. We have, I'm pleased that you're tuning in to us right now. And we also, we're going to collect your questions, and our objective is to answer your questions to the best of our knowledge. We won't have all of the answers to your satisfaction, but what we will do is we will get answers to you, and we will respond as quickly as we can. So with that, what I'd like to do is turn it back to you.
I'd like to make one more remark that this virus poses a greater risk to some in our community more than others. And people make decisions based on their individual situation. And all of us should try to support and understand the decision that others make for their own safety. We have to be understanding of that.
Right.
Okay, with that, I think we just turn it over and take some questions.
Okay.
Let me ask the Zoom audience, if you have questions, go ahead and please start typing them in. So the first question is about getting ready for something like this. What is the lab's plan for handling a pandemic?
Yeah, well, I should say, first of all, say that we've had a group working on this now for some time, And at every time, they've been looking at where it could be going and how to get ready for that. And so and Michael Brandt's been leading those discussions.
So part of the preparations that we've been doing is bringing together our experts, and we've been monitoring the Centers for Disease Control website. We've been looking to local public health agencies, and we're following their guidance. As an employer, our objective is to prepare for this by doing the following things. We're looking to understand how the disease could be transmitted in the workplace. For example, on our shuttles, we have increased the cleaning of the shuttles on a daily basis, and we're doing a deep cleaning of shuttles on a routine basis. That's being done weekly now. We're listening to your concerns. We've met on a daily basis to do such things as encouraging employees to telecommute, for example. And we want all of you to work with your supervisors to telecommute where possible, and we have streamlined that process, and the streamlined conditions will be in place for the next 30 days, and we'll make adjustments to that as we go forward.
Okay, we have a question from Zoom. If someone at the lab is tested positive for COVID-19, what are the next steps?
You want me to take that? So just following up on the last question with regards to, there is something called a pandemic plan that has been at the lab for at least a decade that I'm aware of. And that plan is a phased approach. And so it follows the World Health Organization definitions of pandemic. That plan has been shared with the Department of Energy. So I think you'd be able to see it. But the idea is as things increase incrementally, there is a response incrementally. So a single case, so as opposed to a pandemic, a single case of an individual who would present on site currently would trigger a public health response. So in the theoretical sense, what would happen is we would get notified, likely by the person, likely a few days after they realized they were ill because of the way the testing is being done currently. That would then trigger a notification to public health if they didn't already know already, which would then start something called contact tracing. I can show you a slide on what that means. Maybe Mark, if you can pull that up. So that contact tracing would then work with the public health, would work with the individual and figure out who they may have exposed. When someone says, hey, I think I may have come in contact, we ask that the person and the supervisor keep a list of who they think those potential people would come in contact with. That would then be with our local public health authorities. We would work in trying to determine what the actual exposure was. That exposure then would decide what mitigation steps would be taken. So some of you may recognize these slides from the other day. So what I want to show you is two things. What I just talked about was contact tracing. These are two slides that came out yesterday yesterday night from the University of California. I think they're helpful. These will be posted for you. But the idea is to show sort of the process of what would occur. And this is how the University of California understands this. And we would follow this. So just to give you an orientation, you have some terminology on the top, action in the middle, and then diagram on the right. So I talked about contact tracing down at the bottom. So which is down at the bottom. So if you were to have somebody who were to test positive, so if we were on test positive here, that then starts the contact tracing, and that's done with public health. So people would be assessed for exposure with public health, and then responses could be, hey, we need to do some self-isolation. That's all dependent on the scenario.
Okay. Under what scenarios would the lab move to minimum staffing or lab closure?
Yeah. Well, the group's been looking at this phased approach.
So just as Dr. Durrani was talking about tracing cases, what we're going to do is that let's just assume we had a case in a specific building. We would we would identify that employee and then all of their contacts. Just as Dr. Durrani described, we would identify all of those contacts. We would go in and decontaminate the building. We'd make sure that the building is evacuated. So we're going to use a graded approach. We'd isolate that building. We'd go in, decon the building, and then clear that building for reoccupation. But we would take the employees who were contacts, and those employees would, we would ask those employees to stay home, self-isolate for 14 days, and then check back in through medical. Our approach at the laboratory is to use this graded approach to understand how to control the spread of the virus across the lab. If it occurs in another building, we would do the same thing, and we would repeat the process. At some point, if this becomes widespread, then under those conditions, we would need to consider whether or not the laboratory should remain open.
I think a general thing is to emphasize that we are talking about this every day because this is a rapidly changing situation that our society is going through. And so these groups are considering these issues every hour of every day and seeing how to update them on the basis of the new information that comes in.
In addition, if let's just say that we decided that we needed to close the lab, we would operate much the same way we did during the public safety power shutdown. We're not talking about powering down the laboratory, but we would need a minimum level of staffing to safely continue to keep the laboratory operating, which means it would be, in facilities terms, we refer to that as warm and dark. We'd keep the heating and cooling, electricity would be on. We would maintain any critical scientific operations, such as the animal colonies, and we would, to do that, we're going to need to rotate employees into the laboratory and to continue to operate the lab at that level. Emergency essential employees will be identified, just as we did in the PSPS, and only those employees would then be allowed to come on the laboratory's property. And frankly, with that amount of social distancing, their level of exposure would be greatly reduced in an occupational environment.
All right, well, we have well over 1,000 people on the Zoom, and we know that several groups have gathered as a group to watch this video. So again, you're having a large reach here today. We have a couple of travel questions. One of them is around, are we going to continue to allow domestic travel, or are we going to make any recommendations? And what about the international travel ban that was put in place last night? Can you comment on that?
So let me say one thing, because we have a lot of international students, scholars at the laboratory. You should keep in contact with the office that you're used to reporting to keep track of what's going on if you have any questions. And for our travel, you see the recommendations already that we're prohibiting international business travel, minimizing the domestic travel, and in fact, we've just been going through the round of actually contacting our people abroad and making sure that they get back as quickly as possible. That's been going on.
Right. So we need to think about this in a pragmatic sense, in that what we want to do is to increase social distancing, and as a way of minimizing exposure, or at least maybe even eliminating exposure, depending on the distance. We're asking all of us to consider the trips that we're thinking about taking domestically. Is that trip absolutely mission essential, one? And two, can we accomplish the goals of that trip in another way by using video conferencing, Zoom, telephone calls, and so on? And so at this point, we have not suspended domestic travel, but we're encouraging each of you to consider the essential nature of that trip to our mission.
Let's see. For folks who read your email yesterday about encouraging telecommuting, What can we say to supervisors during this time regarding flexibility in people's work schedules?
So in terms of flexibility, our policy at this point is we're encouraging telecommuting, and I'm asking supervisors to take a look at the guidance that we've sent out, and that means flexibility means that we have a new policy, a shortened approach, one form that would be filled out, and that telecommuting policy will be in effect for the next 30 days. We don't know the full course of this public health emergency and how long this is going to last, and we will evaluate, as we get to 30 days, we will evaluate the telecommuting policy, and if we're still in this emergency, which is very likely, we will extend the telecommuting policy. But we do have, I want to emphasize, we do have a telecommuting policy, and we're asking all of you to begin to exercise that policy. Work with your supervisors.
Yeah, at high level, we're encouraging the supervisors to be creative in finding solutions to the situation we're in, which is unusual. And we have some very excellent supervisors who we are sure will find ways of doing that.
And there will be questions. So if you're a supervisor and you have questions, you're not sure how to implement this, talk with your HR representative, and they'll help walk you through the process.
Quite a few people are asking about test kits, if they should get tested if they have any symptoms, and if you've got test kits here.
Sure. So testing has come up a lot. I would say I'll start general and then get very specific. With regards to testing, there is no mandated testing on site, meaning we are not forcing people to do any testing. We would never do that. The second question is with regards to voluntary testing. I may have symptoms, I'm concerned. That I would defer to your primary care provider. The reason is that majority, almost all the providers, large providers in the Bay Area, UCSF, Kaiser, Sutter, so forth, all have policies, protocols around safely obtaining the test and then sending it through what's now going to be the private labs. We at Health Services are currently not testing for a variety of operational and logistic reasons. So no, we're not testing at this point. What we are doing is referring people to their primary health provider. What we are saying is if you have questions, give us a call. We're happy to help walk you through that. I know that there are people who are having trouble getting in through their, the health services, health providers are overwhelmed. So we're happy to do that. At the same time, we have limited resources that are for the entire lab. And so for those operational reasons, we want to be able to maintain our healthcare providers for the lab and still be able to address employees, all the other concerns that continue with a lab this size.
Dr. Durrani, a question came in on what is the protocol? If someone is sick, maybe they have the seasonal flu, what do you recommend that they do? What actions do they take? How long do they wait till they come back to work?
Thanks, that's a great question. So one of the things that I want to emphasize is that from the health services standpoint, a lot of what we're doing is something we do all the time in terms of our responses. There are a variety of infectious diseases, communicable diseases that we deal with regularly. We're just adding this to the list. So in that vein, I would tell you that if you have symptoms, could be coronavirus, could be something completely unrelated. There's good guidance that we have followed that comes out of the CDC. It says, if you're sick, stay home. If you're symptomatic, stay home. If you have a fever, let's wait until you have had 24 hours that you've been fever-free and not taking any medicines before you come in. Now, that's a very broad response to a lot of very individual questions. So if you have very individual questions, I would say, give us a call. We're happy to walk you through it. But to give you the sort of broad brushstroke, if you're sick, stay home, both for coronavirus, influenza, a number, 14 different viruses that are common in an upper respiratory infection. We generally don't want to have anybody get sick of anything. Obviously, in this environment, not in the corona sense.
Kind of a follow-up to that, a couple people have asked about contact tracing. Should we be keeping diaries of where we've been and who we've been with so that if anybody does show up with a virus, we know who to notify?
That's very proactive. That would be terrific. We're not mandating any of that, but that would be great, particularly because that would help with the contact tracing piece. As we know, people have a hard time remembering what they did the day before, who they came in contact with, and so forth. If you were going to be proactive, that would help us, and it will help the health department, and so forth. Yeah, that's a great recommendation.
Does the lab have any role in the national response to the COVID-19 virus?
I can say that the department has asked all the laboratories to report up both things that they're doing now, things they could do, what capabilities they offer. And so they're making this available to people in the government who are operating here. And the range of things in the laboratory system include actually, of course, studying the structure of the virus and understanding where therapies might be developed is something we're doing. There are other things we're doing. So needless to say, the primary role is that of the CDC and others, but the labs are providing a supporting role in that effort.
And John, I met with the 17 COOs from the other national laboratories, and each one of the national laboratories is working, they're implementing their pandemic plans across their labs, but the practices between the labs are being shared so we can harvest the best practices and help one another respond to this growing emergency.
If there are employees who may not be able to either work from home or don't have leave that allows them to work from home, what is the lab working on or doing to help in that situation?
So I think the best example to use is during PSPS, we had many employees teleworked. We had essential employees working here during the closure, and then we did run into that circumstance where we used administrative leave. So if an employee does not have any PTO available, we ask that they work with their supervisor, and the supervisor work with HR, and we will ensure that they're covered under administrative leave.
Yeah, some of these issues we're running into, of course, are very familiar from last October when we had the power shutdown, and many of the procedures are based on that.
Right.
Okay, this one's a shout out to our custodial staff, to thank them for all the hard work that they've been putting in. So question is, what is the new procedure for custodial staff, and are they staffed appropriately to do what we're asking them to do?
Yes. So
thank you for shouting out to the custodial staff. They have a hard job and they do it well. We have been in contact with the custodial staff on cleaning procedures through EH&S. So as I mentioned, a lot of what we do, our response to this is very similar to how we do other things. And so are they staffed appropriately? I don't know that I can answer that question. Are they suited to do the job in terms of training and so forth? My understanding is they are. And we are revamping policies around what's the appropriate cleaning policy, cleaning procedure, and so forth. As some of you may be aware, the EPA put out a list of appropriate cleaning products. So we've reviewed those and ensured that the appropriate cleaning products are available, both to the custodial staff, but also to our employees. And I'll emphasize again, as I did last week, the cleaning products that exist are sufficient, at least as we go through the list. So we don't need to combine cleaning products or create something new that could cause a potential different course of action or injury. Right? The cleaning products that we've identified that have been put out are appropriate per the EPA.
Okay, sort of a follow-up, but for all of you, what about the cafeteria? How would we do something like social distancing there, and what are the cleaning procedures in the cafeteria?
So with respect to the cafeteria, we have sanitation practices and food safety practices that are standard. And EH&S, they do inspections of our cafeteria, and we have met with the cafeteria workers and reemphasized safe handling of food and the work practices. And so from our previous inspections, we have good food handling practices. What we're planning to do within the cafeteria is to, first of all, we're not going to close the cafeteria. I know that question has come up a number of times. What we're going to do in the dining hall is facilitate increased social distancing. We're going to take practices such as reducing the number of chairs in the room in order to create space for you to still use the dining hall, but to be able to have greater distance between you and others. But I do want to emphasize, we have safe food handling practices. They've passed inspections. The workers are trained, they're qualified, and we have no reason to believe that that there is any increased risk associated with our cafeteria workers.
What is the lab's current posture with regards to visitors coming into the lab? The lab is not closed. I know you have some self-isolation policies for people who have come from CDC level 3 countries, but what is our current position on visitors and guests?
Well, I should say first that we have many groups visit the site in a regular way, and we're no longer doing those. School groups and other casual visitors to the site. In other ways, I think steps are being taken to effectively keep the visits to the site to those that are actually mission critical, which of course reduces the number of visits directly. We also generally want to make sure that, of course, people who are coming to our site who have come from abroad actually are following the same policies our employees do. And it's in the same situation. They should not come into the site until they self-isolate.
Right. And we're engaged in discussions with the user facilities right now. I suspect that there are some questions about what are going to be the practices at those facilities, and we will have guidance coming out about that later on today.
Last night, the president announced a travel ban from European countries. Do we have folks overseas, and what's the status with our employees overseas?
Well, I can say there's been a lot of activity in the last day, identifying all of our people who are abroad and in many cases arranging to get them home. And we've been following that up just in the last 12 hours, and I think pretty soon we'll have all those people taken care of.
All right. We have a couple of questions on the expedited telecommuting process, wanting to know where to find that form, and if you already have a telecommute agreement in place, do you need to use that, or is your current telecommute agreement still good?
So if you have, so what I'd like to do is I'm going to turn this one over to Wade to answer that question specifically, because he's been working as part of the critical incident management group, and he'll answer that.
Good morning, everyone. This is Wade Cross, a member of the HR leadership team. Thanks for the question. So there is an expedited process. The form was sent to all supervisors yesterday through LeaderLine, so the form can be accessed through your supervisor, and that would facilitate that conversation. The question about whether or not to do one if you already have a telecommuting agreement in place, we are recommending doing this because it's expedited, and if it's an agreement in excess of what you've already been approved through your existing telecommuting agreement.
Another one that came in from our wonderful IT help desk, they just would like to remind everyone that if you need to telecommute or you think you need to telecommute, please check all of your software and access now. Don't wait until you really need to do it. So thank you, IT help desk, for that. A couple of questions came in about sharing leave, the people who have access compassionate leave, if they need to share that or can they share that with anyone?
I'm going to turn that back to.
If someone doesn't have enough leave to take care of somebody or to stay home, can you share leave?
So I think the question is related to the voluntary vacation donation policy, and currently the way it's designed, it does not allow for catastrophic leave sharing in the circumstance. So your option would be leave without pay under current policy.
All right. Another question that is coming up about Dr. Duran. I think this is your area again. Packages. Question is, how long does the virus stay on surfaces, and are we doing something different in shipping and receiving and packages? Should we be doing something?
Thanks. It's a good and interesting question. I think we've addressed part of that. I think one of those, there's a similar question in our FAQ, so I'm not sure that I'll be able to recite it for you perfectly. In general, when we look at viruses, some viruses can live on surfaces for longer periods of time than others. In the family of coronaviruses, we understand that to be maybe a day to a few days. There's a number of publications. There's one that came out last night that was looking at different types of surfaces. Generally, surfaces, and this is in general, surfaces that are non-porous are much easier to clean and wipe than things that are porous. And so if we have that concern, we say, well, let's wipe it down. I haven't seen any evidence that packages, food or otherwise, are a way to effectively transmit an infection. So there's a difference between a virus living on something and being able to actually pass infection, create an infection to someone else. The reason generally in the biology world is thought that there's just not enough there. If you need a certain number, let's call it 10 just for a number, if you need a number of 10 particles, that there's not enough that can be transmitted on that package. So I haven't seen any science that says packages or food or any other thing are an effective way of transmitting this. With that being said, there's no reason why we wouldn't use our enhanced cleaning procedures and so forth that should be sufficient. I haven't seen anything that says everything that we're doing right now is not sufficient to protect people.
Can you say anything about the shuttles and the cleaning protocols for those?
The shuttles, can you repeat? You faded there, John.
The cleaning protocols for the shuttles, have they been changed?
The frequency has changed. We're cleaning daily, wiping down the surfaces, and then we're doing a deep clean at the end of each week.
We've had a few incidents on site or off site, people treating other people differently because they are wearing a mask or have made certain choices. What can we say about those incidents and people's choices during this time?
Yeah, well, I can speak. It comes up in other situations we've talked about providing an inclusive work environment so that everybody who comes to work here feels safe and psychologically safe. And this is something that's an ongoing discussion with our community. And I will say that stressful situations like this can bring out sometimes behavior, can enhance this behavior. And so I just would like everybody to think that everybody's dealing with a different level of stress, different situations. Please be understanding of those around you and try to show that we are an inclusive environment. We take care of the people around us, and especially in a stressful time like this, people should do everything they can to make it a comfortable place to work. It's hard enough dealing with the situation without having these incidents to deal with as well.
Is the lab considering something like changing work hours around for those people that can't telecommute so that we can increase social distancing by having people work at different hours of the day?
Actually, that's an excellent suggestion, and we'll take that under consideration. And I do want to remind everyone that this is a very fast-moving situation that we find ourselves in. We appreciate your suggestions and comments, and a suggestion like this will be taken into consideration so we can treat everyone equitably, because we have a large fraction of our population that can and will telecommute, but we have others who have essential job functions here for which telecommuting is not possible, and we will do everything we can to ensure their health and safety and well-being. And if that's adjusting the hours, we will do that.
I'll read this verbatim. My question is on the telework policy. The lab is encouraging telework at this time. does that mean it is voluntary, decided by an employee at his or her own risk instead of supervisor's decision? It is not mandatory at this point, right?
That's correct. We are encouraging telecommuting, and we want everyone to work with their supervisors. And so we have not instructed supervisors that this is a mandatory practice.
Some employers are taking, apparently checking employees for fevers as they come onto the work scene. Are we thinking of something like that?
So as of today, no. There's a variety of things that I would point out. Now, there was a chain, there was a pandemic that was declared yesterday by WHO. That then allows for additional things that can be done by employers. The idea of taking someone's temperature while possible, physically possible, I'm not saying we would do it, is then from a practical standpoint is what do we do with that information? And so we'd have to think long and hard about if we start to go through and doing what can be considered somewhat invasive. Part of this is, although I'm a physician, in the workplace setting, there are certain rules that have to be followed by the employer. And so outside of an employment scenario, sure, a doctor can check your temperature because you voluntarily go there and say, hey, doctor, I want, can you help assess me? It's a different scenario to say the employer is going to go out and start doing these things. Now, there are things that can be done, that can say, if you're symptomatic, please let us know. If you were told by a public health authority or your physician that you have COVID-19, please inform us. It's a different scenario to go through and start mandating people go through a variety of exams. So if we were to do that, and I'm not saying we are, it would be a long thought process that would involve not just me, but an entire team of people, to include our employees, so that people would understand. If public health started recommending that would be a long discussion that we would have. And different employers, quite honestly, have different thresholds, and some of them aren't in the state of California. And so the state of California has a variety of things that are different from national requirements.
I should emphasize we're counting on people acting responsibly in this situation and staying home if they have any reason to think that they're sick. This is common sense, but this is not a time to be heroic in fighting that to come to work.
Right.
Okay. The dreaded four-letter word, mask.
Oh, yeah, I don't mind the mask question at all.
We got this far into it before getting there.
I know. I was kind of surprised myself. This one's specifically about should the cafeteria servers be wearing masks, and then the rest of us. Masks, yes, no, why?
Sure, yeah. So I'd like to reframe the question a little bit, because if I can get you to understand, if we can talk about where masks have been shown to be beneficial in an occupational setting, and then when they haven't been shown in an occupational setting, and then what the current thinking is around non-occupational in terms of risk. So in the occupational setting, the literature is probably 40 to 50 years old, meaning that it has been studied for now 5 to 6 decades. A lot of that literature coming out of the national labs, looking at the protective nature of masks in an occupational setting. We know in certain settings that those masks are helpful. Now, that's understanding that we have created an environment where we have minimized the exposure as best we can. This is an occupational setting. So in some scenarios, in an occupational setting, the masks are helpful. But it's one thing to recognize, they're the last ditch effort in the occupational realm, because it has less to do with the function of the mask and more to do with human behavior and human nature. We know that people will put on a mask, they'll wear it for a short amount of time, then they start touching their face, the mask gets dirty, it's no longer effective, and so forth. That's in the occupational setting. There is guidance right now for healthcare workers who are working around someone who has a known infection, who is openly infectious to them, for them to wear masks. There's also a shortage on those masks. I'm saying mask, but I'm really describing something called a respirator, which has a very defined definition. So we know healthcare workers who are working with people who have this infection need to wear them to try and minimize that, both to protect the healthcare worker and to allow that healthcare worker to go see the next patient. In the only other setting that's been recommended in the non-occupational realm is people who are household contacts of someone who is known to have this disease, this virus. So, and that's on the CDC website. I think we have it in our FAQs. But those are the two scenarios that respirators are being recommended. The third scenario that we get asked a lot is, well, what about if I am going from here to the grocery store or here to home, or a variety of different things, sort of in my daily life? My response has been, you can, if you want to do that, I don't have any reason to tell you not to do it. If you like that, if that's something that makes you feel better, I think that's fine. If you're then ask me, can I start making other employees wear this, or should I say you have to wear this? I would say no, because there's no evidence that is going to improve or reduce risk. There is some evidence that by wearing a mask, there's a small but increased risk of actually being exposed. I think the jury's still out on that, so I wouldn't hang my hat on, well, wearing a mask increases your risk. I think that wearing a mask in the general population hasn't been shown to reduce risk. And it has less to do with the function of the mask and has all to do with human behavior. If you told me that you were going to wear one mask for 8 hours, I would tell you it's going to fail. We know that based on all the literature. If you tell me you've got an unlimited supply of these disposable masks and you can switch them out every time it gets soiled, something happens, somebody coughs on you, that's a different scenario. That's how things are done in an occupational scenario. But we know that's generally not the case based on human behavior. So if you and your healthcare provider want you to wear a mask, I think that's fine. I don't have science to tell you you must wear a mask in the general population. If you're in those categories I talked about, that's where the recommendations come from.
Kind of as a follow-up to that, in the United States, you don't see a lot of people wearing masks normally, but in other countries, you do see people wearing masks. So if we were walking around at the grocery store and I saw somebody at the mask, should I be wearing a mask? Should I be more concerned about standing next to them in line?
No, I mean, I can't tell when someone's wearing a mask, why they're wearing a mask. If I'm at the grocery store, I don't know if they're wearing a mask because they want to wear a mask, because it's part of how they grew up. It's that kind of thing. So I can't interpret by looking at someone what the mask or the mask doesn't mean, and so it doesn't. For me, it's a piece of information that I'm unable to appropriately or actively interpret. So someone wearing a mask in the grocery store may be for a variety of reasons, and it wouldn't change my behavior by someone wearing a mask.
We have a couple questions about visitors coming to the lab. We know that the level 1 said something about, you restrict it, non-essential. Are you looking at a policy that perhaps would stop all visitors coming to the lab?
So we are stopping and discouraging visitors coming to the lab. So for example, we have a number of, we have a monthly tour open to the community. We've canceled that. We've canceled other things such as bring a kid to work day, and that's been canceled. These are optional. These were optional visits that were and events that we're canceling because the public health guidance at this point is to reduce large gatherings of people, and there's no reason for us to continue to invite others into the laboratory during this crisis.
A couple of people have written in about they're sitting in their desk situation is such that they don't have social distancing in their workspace. What can we say to people? What are their options in terms of this?
So it's one of the reasons why we're implementing telecommuting, is to increase social distancing. And if, for example, you're unable to create that social distancing through telecommuting, we would like you, in your work with your supervisor, and invite ESNH into your workplace, and we'll work with you to find a solution.
The other thing I would add, and I think we have this on FAQs, and if we don't, we can add the link, but the CDC has interim guidance for institutions and business, I think is the term. And so if you go through and look at that, it talks about, well, what if I can't do this? And so what are some of the responses? So some of the responses are, we'll increase the frequency of wiping down the table, increase the frequency of washing your hands, and so forth. If you go to that guidance document from the CDC, that is what we have been relying on in this scenario. I think those are prudent measures that I'd encourage you to look at. And if you feel like that's not being followed, I think it's worth bringing up from your supervisor all the way up, because those are measures that have been advocated for.
We have a couple of questions on home care. If somebody has a pre-existing condition, should they be more prone to doing telecommuting?
That's an interesting question. That gets into sort of the individual. So it's hard to know what without seeing the specifics. But we know that there are certain groups that have increased risk for complications. The question is, one question comes up is, if I have this potential health condition, does that increase my risk for exposure? I haven't seen any evidence that having a particular condition increases your risk for exposure in the general sense, in the community, in the workplace, unless you work in a place like a healthcare setting, in which case you could have an increased risk. So I haven't seen anything on the risk side. Now, on the outcome side, if someone with one of these conditions has an exposure and then is at increased risk for significant complications, yeah, that can be a concern. I think the best approach that I could provide is let's look at that as an individual to try and figure out what that means. There are, and I'll defer to the HR group, but there are HR processes of ways of looking at an individual without having to get into your specific medical situation. Although if you wanted to offer it up and I'm happy to go through that with you. But you don't have to reveal any of that. There are policies and guidelines that HR has used for a long time that still apply here. You have a particular concern, bring it to the HR group and see if there's a way to mitigate that. And if I can be an advocate or a resource, I'm happy to do it. I don't, without looking at the specifics and knowing both, the potential for the exposure and then the potential for what somebody does in a work site, I couldn't give you more specifics than that.
All right, we have a question for our interns and people that want to intern. Are there any changes to programs like that going forward that we can forecast?
None at this time. That HR? No.
All right. Let's see, what else is there? Modeling question. Could you just talk about the modeling of the growth of the virus in the cases of the COVID-19 based on the information that's available and applicable to the Bay Area?
Sure. I've seen 19 different models that predict different things. This is on, I think, the national and international level. I wouldn't be surprised if we had 19 models for the Bay Area. Part of that has to do with it's such a rapidly changing environment. On Monday, I think I showed we had, 100 cases or something. We're now at 1,000 cases. Does that mean that Monday there weren't 1,000 cases? No, that means that testing is coming online. I fully anticipate, and I think public health agrees, that we are going to see more numbers, meaning more cases. The question is, how do you interpret that? Well, if we're testing more people, we're going to get more cases. The next question is, if we can get that somehow standardized, then can we start to understand how quickly this is growing? And so I would say we're pretty early. To give you a sense, when the time that we know when flu has done its most on a national level is the year after it's come out. And the reason is because all the modelers, all the epidemiologists, they now have a year's worth of data and they're able to go through all that. So in 2 years, will somebody be able to tell you this with near scientific certainty? Sure. In the days that this is going on, no, I don't think I haven't seen anything that somebody's been able to point at. So we anticipate both the testing is going up, which means we're going to see more cases. How to interpret that, is pretty hard to do, particularly if you're not sitting at some place like an epidemiologist who's sitting at the public health department, either local, state, or national level. Part of the reason is just the perch. Where are they sitting? They're able to look down and see all of the data. Very few people have access to all of that. And so that's part of why we go back and say, hey, public health, tell us what it is you're seeing, because they are the people who have this data.
Thank you. We've run out of questions online, and so I think we're going to end the session, but I'd like to ask Dr. Durrani to one more time summarize for us the most important things we can do to keep ourselves safe.
So with regards to the coronavirus and where we're at, I'm sure that at this point people are tired of hearing it, but it has to do with what we know works, right? Hand washing. Try not to touch your face. If you're sick, stay home. If you're able to limit your travel, that's great, right? There's questions around whether or not that's the greatest risk, but things that we know are hand washing, staying out of these large groups. Those are all things that are being advocated for by public health. And don't forget all the other things that still go on in your daily lives. Not so much risk, but just trying to get that little bit of wellness in there.
Okay, anything else, Michael or Mike?
Yes. What I'd like to encourage is that all of you continue to send in your questions. We have our subject matter experts are working your concerns and issues that we see every day, and we will continue to keep you informed through either level ones or on social media, or using elements. So we have a variety of ways to get the message out, and we will implement appropriate controls as this situation continues to develop, and we're asking for your support and cooperation, and we will update our frequently asked questions.
So I can just say, to remind people, our top priority is protecting the people who work here, their health, their safety, and all the people who are in this room with me are working very hard on how to do that. Please understand this is an environment that's changing very quickly, and everybody's doing the best they can to protect all of us. So thank you.